Bismillahirrahmanirrahim. Hello, dear students. The chapter 38 has been finished, and at the moment we focus about the chapter 39. The purpose of this chapter is related to pulmonary circulation, pulmonary edema, and pleural fluid. Okay, and the special problems related to pulmonary hemodynamics have important implications for gas exchange in the lungs. The present discussion is concerned specifically with these features of the pulmonary circulation. In general, the lung has two circulation: high pressure, low flow circulation, and low pressure, high flow circulation. Okay, two in the lungs. The high pressure, low flow circulation supplies systemic arterial blood to the trachea and bronchial trees, including the terminal bronchioles and the supporting tissue of the lung, and the outer coats, adventitia of the pulmonary arteries and veins. The bronchial arteries, which are branches of the thoracic aorta, supply most of this systemic arterial blood at the pressure that is only slightly lower than the aortic pressure. The low pressure, high flow circulation supplies venous with blood from all parts of the body to the alveolar capillaries, where oxygen is added and carbon dioxide is removed. The pulmonary artery, which receives blood from the right ventricle and its arterial branches, carry blood to the alveolar capillaries for gas exchange, and the pulmonary veins then return the blood to the left atrium to be pumped by the left ventricle to the systemic circulation. In this chapter, we discuss the special aspects of the pulmonary circulation that are important for gas exchange in the lungs. Okay. The physiological anatomy of the pulmonary circulation system is very important. The lung has in total in the three circulations: pulmonary and bronchials and lymphatic. And in the total, in the comparison of the pulmonary and systemic circulation, where we mentioned we have two circulation: pulmonary circulation and systemic circulation. Pulmonary circulation have a low pressure, and because it only needs to pump blood to the top of the lungs, and if it is high pressure, then following starting force, the fluid would flood the lungs. And this system in this circulation have a low resistance, only 1/10 of the resistance of the systemic circulation. The resistance is very low in the pulmonary circulation. Arterioles and have less smooth muscle, and veins and wider and shorter, and pulmonary vessel walls are thinner. Okay. Another features and characteristics for the pulmonary circulation is high compliance, and accommodates 5 liters of the blood, same as the systemic circulation. Accommodates shifts of blood more quickly. Example, when a person shifts from the standing to the lying position. On the other hand, the systemic circulation and have a high pressure, is need to send blood to the brain when standing, or to the type of an elevated finger tip. And this circulation system, and have a high resistance because of the increased smooth muscle in the arterioles and the meta-arterioles. This okay, in comparison with these two systems. Another is for the systemic circulation have a low compliance because of the resistance offered by the arterioles and the meta-arterioles. Advantages of the pulmonary circulation being the low resistance system. This very is important. Accommodates more blood as a person shifts from the standing to the lying position. High compliance allows the vessels to dilate. The response to modest increased in the pulmonary arterial pressure. The pulse pressure in the pulmonary circulation is rather low. Is another features. In the pulmonary vessels, okay, the pulmonary artery extends only 5 centimeters behind the apex of the right ventricle, and then they divides into right and left main branches that supply blood to the two respective lungs. The pulmonary artery is thin, and when the wall thickness on the surface that of the aorta. The pulmonary arterial branches are very short, and all of the pulmonary arteries, even the smaller arteries and the arterioles, have larger diameters than their counterpart of the systemic arteries. This combined with the fact that the vessels are thin and distensible gives the pulmonary arteries a large compliance, okay, averaging almost 7 milliliters per millimeter mercury, which is similar to that of the entire systemic arterial tree. This large compliance allows the pulmonary arteries to accommodate the stroke volume output of the right ventricle, okay? And the pulmonary veins, like the pulmonary arteries, are also short, and they immediately empty their effluent blood into the left atrium to be pumped by the left heart through the systemic circulation. The pulmonary circulation, the pulmonary artery is the thin wall that we mentioned before, and distensible, as giving the pulmonary arteries three large compliance. Is very important, these features. This large compliance allows the pulmonary arteries to accommodate about 2/3 of the stroke volume of the right ventricle. The pulmonary veins have a distensibility characteristics similar to those of the veins in the systemic circulation. Okay. The bronchial circulation is very special circulation in the lungs. Bronchial blood flow amount to about 1% to 2% of the total cardiac output, and oxygenated blood in the bronchial artery supplies the connective tissue, septa, and large and small bronchi of the lungs. Because the bronchial blood empties into the pulmonary veins and bypasses the right heart, and the right ventricular output is about 1% 2% less than the left ventricular output. This is a very important point. Another we have one term name is shunt. Shunt is the term used to describe a condition in which ventilation alveoli per current or perfusion is zero due to no ventilation. Okay. Anatomical shunts results from the blood vessels that do not flow past the alveoli. Arterial blood perfusing the bronchi goes directly into the pulmonary veins without passing through the lungs. This special circulation, non-main circulation in the lungs. Okay. You see in the figure, okay, the pulmonary arteries have a main pathway to the pulmonary capillary and then to pulmonary vein. Another, we have a collateral arterial branchial collateral and branchial artery and arterial anastomosis, and this non-main pathway, and bypassing for the circulation and bronchial capillaries, and then blood enter to bronchial veins and venous anastomosis, and then this blood maybe transport to the venous bronchial collateral, and then to transport to the pulmonary veins, and or maybe in the mediastinal veins, or the transport to central venous system. This figure shows two circulation in the lung, main circulation and non-main circulation. You can see in the figure, okay, and the pulmonary artery in this here, and the oxygenated blood from the right heart goes into the alveoli, and whereas we have oxygenated blood from the left heart goes to the conducting airways from the bronchial artery. And you can see in the here figure and bronchioles, and then this is the surrounding the bronchioles we have the circulation. We have just one is this here, the from the one shunt circulation, and this from the pulmonary veins, and this almost all blood return to left heart via pulmonary veins. Okay, we have two main pathway, two pathway. The main pathway from this one, and just the non-main pathway for this in this figure shows that. Therefore, the shunt is the term used to describe a condition in which we are current is zero, you no ventilation. In this figure we mentioned in this here, okay, this here, because there is not any alveoli and is not the exchange gas. And the anatomical shunts results from the blood vessel but do not flow past alveoli. Arterial blood refusing the bronchi goes directly into the pulmonary veins without passing through the lungs. In this figure you mentioned this here, okay. Alveolar shunts are not the result from the alveoli that they are not ventilated or are not capable of the exchanging gas. The physiological shunt is the sum of the anatomical and alveolar shunts, okay? And the greater the magnitude of the physiological shunt, the lower the pressure oxygen and the higher the pressure CO2 of the arterial blood. The greater the magnitude of the physiological shunt, the greater the alveolar artery oxygen differences. We have in the lung lymphatic circulation as well. Lymphatic are found in all of the supporting tissue of the lungs. Particulate matter entering the alveoli is removed by the way